Welcome to another segment of Recovery TV. Today, we're going to talk to you about effective methods for treating trauma. So stay with us because that's coming up. We appreciate you being with us today for this segment of Recovery TV. I have a very special guest, my friend and colleague, Terry Gatewood, who is in Palm Springs at Blue Tiger Recovery. I'm going to put a link to Blue Tiger in the description of this video below so you guys can check that out. It's a fantastic recovery center. Can you tell us just a little bit about what you guys do at Blue Tiger?
Josh, first I want to thank you so much for asking me to come in today to talk about this really important topic about trauma. Blue Tiger, basically the whole name, is surrounded about how to heal trauma and helping people find their blue, which means kind of being resourced and having the tools to be able to navigate through those strong emotions that usually come from unresolved trauma.
Right. And so in our work, we do treat a lot of trauma, and we can't just focus on the addiction. As Terry said, we have to focus on the trauma. And so we're going to talk to you today, really Terry's going to talk to you today about 3 proven or effective methods for treating trauma that they all do at Blue Tiger Recovery. They are also methods that other therapists are doing. So if you are searching for a therapist to help you with your trauma recovery, these are some methods you might look into.
Most of the time when we experience trauma in our lives, it could be something almost like a near-death experience of a car wreck or even some neglect. But sometimes you may realize that, wow, do I have some unresolved trauma? Do you lack concentration and focus? Are you having inability to sleep? Maybe you're either losing or gaining more weight than you'd actually intended. Some of these things, and sounds a lot like depression as well. So have you had bouts of depression where you just don't have a whole lot of joy left for everyday activities or even those things you really love? Then you may have some unresolved trauma. The 3 methods we use: somatic experiencing, which is a body awareness modality for healing trauma. It was founded by Peter Levine over 40 years ago through his groundbreaking work. And what we try to do is help clients get to the point where they're resourced within their body so that as these big feelings come up, they can kind of ride them like a wave instead of being suppressed or overwhelmed by them. There are a lot of SEPs, which is a somatic experiencing practitioner. You can go to their website to find one in your local area. And also, the other modality is EMDR. Now, EMDR has been around for quite a while, and it has a lot of studies, so it's empirically researched. And it stands for eye movement desensitization reprocessing. So they used to put a light bar out, and they would ask you to follow with your eyes only, keeping your head still, basically making both hemispheres of your brain working together. And the idea behind it is that if trauma is somehow and the memories of are locked and compartmentalized in different parts of the brain, that having those 2 working together can maybe integrate that process and help you as far as resolve that trauma.
And EMDR is also a method that we've used in our practice, and I'm telling you, it is highly effective and, as Terry said, empirically validated as well.
And the last one that we use a lot at Blue Tiger is may not be a specific trauma modality, but it certainly helps dramatically lower shame. And that's the Daring Way by Dr. Brene Brown. Because shame, and in many, many respects, whether you're being traumatized with physical abuse or verbal abuse, emotional abuse, a lot of that can come out. And if you're shame-based, then that affects your entire life.
Right, which a lot of us are. I mean, a lot of us, and we've been dealing with shame since the beginning of time.
Absolutely.
Right? And I'll make sure I put a link in the description of this video to some works of Brene Brown, because you really need to check out her works, watch her on her TED Talk and some other things that she has. And it's really fascinating, groundbreaking stuff. And so the Daring Way program, which is at Blue Tiger, but also other therapists are doing this now to help with shame reduction, is a fascinating approach to treatment.
If you're looking for a therapist, when you first meet with them, do you establish rapport? And because doing trauma work is very, very vulnerable, it's intimate, but one thing it should never be is re-traumatizing. A therapist should never traumatize a client in order to heal trauma. So that's really important. If you feel like you're being pushed beyond your limits, if you feel like that for some reason when you leave there, of course you may be exhausted, you may be, may have a headache, may have some of those symptoms as well by doing some amazing work. But you also need to make sure, take care of yourself and make sure you're fully resourced before you start diving into it. My grandmother used to have one of those little road runners that used to tip into the fluid and tip.
Oh, yeah.
So sometimes that's the approach I like to take, Josh, is that, sometimes we just tip and touch the trauma a little bit and tip a little bit more. And then before you know it, you're able to kind of spend a little bit more time in it. Trauma work isn't something to be rushed by any means. But interestingly, sometimes with somatic experiencing, it may only take a couple of sessions to unlock some of those unresolved programming. That's what we call it in SE.
Well, I appreciate you being here with us today. We hope that the information that's provided to you today will be helpful in your trauma recovery, and we hope to see you back here next time. Thanks.
Thanks again, Josh.